Hey guys, I hope you're all well. There's a lot of talk lately about outpatient joint replacement, and I wanted to take a couple minutes to discuss what I think are the basics. And the basics are one, location, two, anesthesia techniques, three, the patient, and four, support. And I'll go over each of those. First, location. We have been doing outpatient hip and knee replacement at Williamson Medical Center for several years at relatively low volumes. Now there's increased interest in outpatient hip and knee replacement and trying to go home the same day for several reasons, including COVID. Recently, we opened the Bone and Joint Institute of Tennessee Ambulatory Surgery Center. In fact, that just opened in February. It's actually gained some national attention, and I'll put some links above so you can see some of the national talk around it. But what it is a dedicated orthopedic facility to provide excellent care to you and allow you to go home the same day. So we're doing more and more outpatient joint replacements. The second factor is anesthesia techniques. We used to give you really heavy doses of medicine. You used to go to sleep for the procedure, and that would lead to nausea and vomiting and honestly pretty poor pain control. You'd be in the hospital several days and your recovery would be slower. But now our anesthesia techniques are very different. We're able to do a spinal. Now, we give you sleepy medicine so you don't remember the procedure, but we do a spinal and other nerve blocks around the hip or knee, wherever we're working, to control your pain and limit the amount of those heavy medicines that we give you through your body that have those side effects I was discussing. The benefit is you have good pain control, but none of the side effects, and are able to get up and get moving much quicker, and you feel much more like yourself quicker. The third factor, of course, is the patient. Now, outpatient joint replacement is not for everybody. If you're healthy and no heart and lung problems or other major issues like bleeding disorders, you would probably be a good candidate for outpatient joint replacement, but it's not for everybody, and that's a very specific discussion that must be had with you and your surgeon. So I hope you'll reach out if you have questions. The fourth, and maybe one of the most important, certainly an essential element, is support. Now, we need to support you with good education prior to the procedure. The day of is very well orchestrated to make sure you have all the information before you leave our facility. But also you need support at home. So you're certainly not going to drive yourself home from hip or knee replacement, but you don't necessarily have to have someone in the home with you overnight, but it's sure nice to have them close. We've also beefed up our ability for you to contact us when you go home. So support is really a critical element, and honestly, that's maybe the best part of my job. So outpatient joint replacement, the basics, location, anesthesia techniques, the patient, and support. I hope you'll share this information if it's helpful. If you have questions, I hope you'll ask and comment below. Feel free to like the page for more videos about these topics. Have a great day.